Welcome to Harlow on Healthcare. I'm David Harlow, and I invite you to join me by my virtual hearth as I sit down with healthcare leaders to discuss building the future of healthcare. Today, my guest is Rasu Shrestha. He is the Chief Innovation Officer at the University of Pittsburgh Medical Center, where he is also a radiologist, chief of the UPMC Division of Radiology Informatics. UPMC is a 25-hospital, $14 billion a year healthcare provider and insurer with over 3 million members. Rasu also serves as Executive Vice President of UPMC Enterprises, which is the innovation and commercialization arm of UPMC. You can find him on Twitter at Rasu Shrestha, RASU-SHRESTHA. Welcome, Rasu, and thanks for joining us.
Thank you, David. It's a pleasure to be here today.
Great. So I am interested in exploring a number of things with you today. And for starters, what does it mean to be the head of such an innovation organization at a large conglomerate? Some would say it's impossible to provide an environment hospitable to innovation in such a setting. And I guess maybe by way of getting into that, the question might be, how do you define innovation? And what can you do within a large organization to foster an environment promoting innovation?
All great questions, David. It's really interesting, when we're talking about innovation and you're looking at where we are in healthcare today. Healthcare as an industry is an industry that really is very averse to change, and innovation in many ways by definition means some level of change. When you look at where we are as an industry today and everything that we've managed to do, even in the last 20, 30 years that we've been embracing the digital form factor, we've moved along. We've actually come a long way. We've innovated tremendously in embracing digital. But when I look at UPMC, which is a large payer provider organization, and this yin and yang of the two dynamics, where on one hand you're trying to provide care as a provider organization, and with the thousands of physicians and nurses and other clinicians that we have at hand, and then on the other hand, we've got the payer arm where we're trying to really look at our health plan members, and we're trying to say, all right, what do we do in the best interest of these health plan members? For us, when we look at innovation, when we look at how we collectively as this yin and yang of the payer provider are looking at this broader set of challenges across healthcare, we're taking less of a patient-centric view to innovation, which is what providers typically do, or a health plan member-centric view, perhaps, which is what health plans typically tend to do. We're taking more of a person-centric view, more of a holistic view to what's in the best interests of this person that may at some point end up being a patient. In large parts will probably have coverage from a health insurance perspective, is a consumer that's living and breathing in this day and age where they have access to potentially technology. They're in the midst of all of these challenges around economies in which we live in today, the specifics of how behavior change happens in this day and age today. So innovation, really boils down to many different things for many different organizations. There is no one-size-fits-all approach to innovation. But from a UPMC perspective, we look at it from the angle of what's in the best interest of that person. How do we make sure that we have the capabilities as well as the culture and the commitment to really rethink the paradigm, challenge the status quo, not be afraid to say, all right, look, yes, we know this is how we've always done things in healthcare, but when we're taking more of a person-centered approach to care, this is how we need to rethink the paradigm. This is how we need to reinvent the future of healthcare. And that's the appetite that we bring to the table here. And we've been doing this for a while now, David, and we've evolved our strategies through successes and lessons that we've learned and things that we've done in the past. And we've come to a place right now where, we're really trying to address head on the culture of what it means to innovate in an industry as robust, dynamic, but challenging as healthcare, but also in an environment where, as a payer and a provider, we have the privilege of really not just looking at and thinking about these newer care models and this journey of volume-based healthcare to value-based healthcare, but we're living and breathing it on a day in, day out basis. So that's how I look at innovation and how the teams here at UPMC and UPMC Enterprises really look at innovation.
So you mentioned that you've been on this journey for some time. I'm wondering if you could identify, a concrete example or two so that we have a sense of what you're looking at when you're thinking about a person-centered innovation, a change that can be made in the system. What's ripe for innovation out there today?
We've come quite a ways at UPMC. I think if we go back to a couple of decades and really look at the DNA of the organization that is UPMC, we've always been a very innovative and forward-thinking for its time organization. So whether it's leading the charge in terms of organ transplant and with the Starzl Institute and a lot of the advancements that we've made and things like liver transplant surgery, or looking at how we're really embracing science and technology to advance care processes forward. We've been very innovative over the last many decades that we've been around. There have been some early commercial successes that have come out of UPMC. And what we've done really at UPMC is to try to take the specifics of these successes over the years, the appetite that we have to really continue to push the boundaries forward and to rethink the paradigm and really culminated in sort of the thesis that we have right now in not just creating products and services that we would use at UPMC to advance our mission forward of life-changing medicine, but also to say, hey, look, if there are specific best practices and successes that we've managed to build internally at UPMC, how do we commercialize this? How do we then take it out to market? So I'll give you a couple of examples there, David. So when we look at, some of the innovations that have come out of UPMC, I point to just a broad spectrum of things that we continue to push forward with. On one end, you've got big successes like what we've had with Evolent Health. Evolent essentially came out of the UPMC Health Plan, and it's based out of, 100% of the technology really based out of a solution that we continue to use even today at UPMC's health plan called Health Planet. And back in 2011, we said, hey, look, it's a great solution that we have at UPMC, and we see a rising need for provider organizations as they're looking to take on more risk and work more closely with payer organizations or manage risk more intelligently. So we had a hunch that they'd need more of a technology solution as well as a set of services around it. So we got together with the advisory board, and the brilliant minds, the health plan really came together to create Evolent Health. The second year into the company, TPG came in as the third investors. And, over the last couple of years, Evolent Health did really well. Our hunch was correct that, in fact, there were other provider organizations who wanted to have more of a technology platform that they could leverage with a set of solutions and advisory services that they could rely on. And over a year ago, the success essentially ended up in where Evolent had an IPO event, and it was valued at that point at over $1.2 billion. So we've had big successes like Evolent Health. And again, the notion there being, hey, how do we take more of a person-centered approach to care? How do we really navigate the specifics of value-based care and manage this and manage the risk around looking at populations of patients, how risk continues to shift from the payer to the provider and soon to the consumer. And that essentially was the synthesis of what we managed to push forward with Evolent and the many other innovations and companies and solutions that we're continuing to work on at UPMC Enterprises now. If that was one end of the spectrum with sort of a big success, the other end of the spectrum, a quick example, David, would be Curavi Health, a startup that essentially came out of UPMC. Curavi is a small startup company where they're dealing with the specifics of long-term care and post-acute care. and saying, hey, look, in senior care facilities, in nursing homes, where perhaps the heights of technology today are fax machines, how do we make sure that we bring in technology? How do we, through telemedicine and through these virtual care carts, bring in expertise from these specialist areas across organizations like UPMC or other organizations that would need to bring in specialized care into these specific areas of need, and really revolutionize the specifics of how post-acute care is managed moving forward. Those are specific examples of how we're really trying to think outside the box and bring in technologies, but meet them at the point of where care needs to happen, where behavior change needs to actually happen.
You mentioned behavior change, and more broadly, I guess there's a question of behavioral health, mental health issues, certainly an area of concern in many post-acute care settings, but elsewhere in the continuum of care as well. And I'm wondering whether in recent years you see from your perspective a greater emphasis on mental health, on behavioral health, and whether you see any promising solutions that don't treat this as simply a carve-out to be managed independently of broader health issues.
Yeah, absolutely, David. So, UPMC really started out of the Western Psych Institute. So some years back, we were one hospital, and that was the Western Psych Institute. Today, we're in upwards of 40 hospitals and continuing to grow, and we're the successful, payer-provider organization. And we're challenging ourselves by saying, hey, what does the future really look like? And how do we really take care to the next level, well beyond the bricks and mortar hospitals that we operate in today, to these newer care models. And mental health really is in the historical DNA of UPMC in terms of how we started. And behavioral health, I think, continues to be a critical component to a lot of other disease pathways that we're seeing today, and really the reality of everyday life as we're living it today, going into 2018 and beyond. And when you look at where things stand today, there are lots and lots of challenges. There are challenges of stigma that's associated with mental health. There are challenges of access to expert resources and best clinical pathways around mental health and behavioral health. And part of what we're trying to do is to move these challenges to the next level by saying, all right, how do we innovate around this? So what we did recently, David, was we actually invested in a company called Lantern Health out of San Francisco. And we're working very closely with Lantern Health and our behavioral health specialists at UPMC, including at the Western Psych Institute. We're co-creating a set of capabilities and products that would head-on address those specific challenges that I talked about earlier, one of stigma and the other of access to expert care and resources. And what we're doing is we're really algorithmizing the cognitive behavioral therapy, CBTs, and making these CBT protocols directly accessible through mobile devices to our patients and consumers, and making it easy for them to get access to care and be followed up over time, and have a system where we can triage these patients over time and really have them get access to expert care and resources as we're best able to provide them, but leveraging these capabilities that we just did not have access to previously. And that's what we're really continuing to push ahead with. So mental health and behavioral health factors in very highly in the scale of where our priorities are at UPMC. And just taking a step back when it comes to the notion of behavior change, David, I always believe heavily that, look, especially today, where we are in our journey in healthcare, we've managed to, embrace these digital form factors and really move from analog to where we are today in sort of the reality of digital and embracing all of the clinical information systems, the EMRs, the enterprise data warehouse solutions, the big data platforms, and even as we're contemplating how we move ahead with artificial intelligence and machine learning and really try to escalate analytics to more of a predictive, prescriptive model moving forward. It's less about the data, but more about how we move from data to information and knowledge, marry that knowledge with evidence-based guidelines and best practices and clinical protocols, and really get to behavior change, right? So we talked about behavior change earlier, but that really at the end of the day is where we need to be, right? how do we make sure that, we get to behavior change by getting to the right levels of nudges in the patients that we're dealing with, or albeit even the clinicians, as we're looking at clinical decision support systems and we're looking at some of the challenges of, making the right decisions for the person that's at the other end of that screen or in front of you as you're dealing with them as between a doctor and a patient. How do we get to the right nudges and leverage these insights in an actionable way to actually impact behavior change? So that really is what we're pushing ahead with at a very macro level.
Yeah, that's, as they say, the $64,000 question.
Yeah, that's right. Absolutely.
If you're just tuning in, this is Harlow on Healthcare, coming to you on Healthcare Now Radio. I'm David Harlow, and my guest today is Rasu Shrestha. Rasu, we're talking about nudges. We're talking about behavior change. We're talking about moving things to a digital platform. We're also in a world of healthcare brick and mortar institutions, and your institution recently announced construction of a couple of new facilities at what sounds like a significant cost. I know in the scheme of things, in terms of hospital construction, cost may be more in line with what people think about for these projects, but in the general press, you hear about budgets for new hospital construction. Sounds like astronomical numbers. And I have to ask, as we move more and more online, where do you see the need for replacing, expanding, creating new physical facilities? Is this really the best way to be spending the institution's money?
Yeah, so great question. And, I'll give you the perspective of, where we are as a healthcare organization as we look at the many challenges of providing care, the reality of, on the ground, because we're seeing millions and millions of patients. We're looking at the dynamics of the payer provider yin and yang, as I described earlier, these health plan members, the consumers that we're dealing with. And the reality that, look, if we continue to focus on just managing disease, right? And I say just with air quotes here, because that in itself is challenging. And we're trying to bring in, remarkable innovations in technology and in science and medicine, and we're trying to bring in newer care models, and we're trying to look at things like aging and oncology in ways that we've never done before. But if we're, again, air quotes, just managing disease, then the reality is, regardless of how much money you throw at it or how much technology or innovation you throw at it, it continues to be one of cost acceleration. And when you start focusing on not just managing disease, but also really incentivizing wellness and incentivizing healthier behavior and saying, hey, there's a new reality where if we're able to keep those patients out of the hospitals in the first place, then what you get to is the reality of cost deceleration. And we see this really as a closed system, this integrated delivery financial system, this yin and yang I referred earlier as the payer provider system, that's UPMC. And in that reality, what we've realized is we need to have institutions at UPMC or other places for that matter, where we can provide, the best care that we can absolutely give to you. So imagine, like, if you needed care or your loved one needs care, when you need care, you need to provide the best levels of care. You need that specialized care with, the leading class, set of algorithms, set of science and capabilities that you could personalize to that N of one that's at the other end there. And so that's what we're doing through our care venues. And we announced the creation of 3 additional specialty hospitals. We already have 3 really successful specialty hospitals in the city of Pittsburgh, and what we announced in the $2 billion investment is 3 additional specialty hospitals that we'll be building in the city of Pittsburgh. And what we also announced alongside that, David, is that we would not have any more beds, right? No net new increase in beds as we even contemplate building these 3 additional hospitals. So we're going to have a massive infusion in innovation, in science and technology and medicine, and how we look at these newer care models, and we provide the absolute best levels of care to our patients and to our consumers as they need care and when they need care and they come into these specialty hospitals. But our goal overall as a system, as we continue to innovate, as we continue to move things forward, is to say, all right, look, once we look at these patients that come in with, say, a chronic illness, and we're already starting to do this today, as they come in and we discharge the patients, we want them out of our hospitals and we want them to stay at home. And in fact, we would like for them never to come back to our hospitals ever again. So we're discharging them today with not just a bag of pills and a discharge summary, but we're discharging them with technology. We're risk stratifying our patient population of these chronically ill patients that would come in, and we're saying, all right, look, here are multiple things that we can do with your permission to measure specific vitals, to measure specific patient entered data, to then match that against this intelligent hub that we have at the back end that's algorithm driven, but also driven by these newer care models that we're trying to push forward. And before even that person falls off the guardrails again and ends back into our hospitals or ends back in one of our emergency departments, we would know that that person is about to fall off the guardrails, and we would be able to intervene, and we'd be able to nudge that person back towards healthy behavior. And that's really the goal of this entire system, this ecosystem that we're trying to create here. So we want to meet our patients and our consumers where they need us the most. If they need specialized care, then hey, we have it, right? But our goal overall is to keep them healthy, keep them well, keep them away from our hospitals, because that we see is really the best path forward, not just for us as a UPMC, but really for the industry as a whole, to move and address some of these more dire challenges around cost and quality and access and all of the challenges that we've been dealing with in healthcare even up to today.
Mm-hmm. So if I may, I would hazard to guess that you have a broader conception of definition of hospital than what many would today consider to be a hospital. You're describing a new set of outpatient services, really, rather than an inpatient hospital, and a new way of delivering those services, or expanding upon the platforms that you're using today to deliver a newer kind of outpatient service.
Absolutely. It's a continuum, right? And even as we challenge ourselves to say, hey, look, it's not just about the bricks and mortar hospitals that we own and operate today, but as we challenge ourselves and say, hey, look, in the future, in the near future perhaps, heads in beds will not be a metric of success. It should not be a metric of success. In fact, if our beds are filled and we have failed is a mantra that we buy into as well. And when we look at some of the investments that we've made in technologies and capabilities, like what Vivify Health, for example, pushes forward, this is a big bet that we're making at UPMC, where we're saying, look, it really is about this continuum of managing illness, but managing it really well, keeping patients out of our hospitals, but really trying to sustain them in this circle of wellness and keeping them well outside of what we've traditionally known as our bricks and mortar hospitals.
Right. So if you were to wake up tomorrow and find yourself 5 years in the future, what is one thing in healthcare that you would hope or expect to be radically different?
That's a great question, David. And it's a challenging one because you're now getting me to pick one thing. What I'd love to do, if we're able to 5 years from now, perhaps sooner even, really have technology be invisible. Look, if innovation is done well and done right, then technology should really disappear. Today, technology is more of an impediment to care. We've implemented electronic medical record systems and all of these clinical information systems that are helpful in many ways, but also in many ways get in the way of providing care. We're spending anywhere from 40 to 44% of our time with our backs to the patient, and we're entering notes into the EMR. And innovation, if done right, would make technology invisible. So even as we're looking at capabilities like machine learning and artificial intelligence, and we're looking at the next evolution of interoperability and data liquidity, my hope would be, hey, look, if we can make technology invisible and really allow for technology to augment who we are as human beings, wouldn't that be great, right? If we were able to, for example, free up our time and have technology do more of the mundane, rigorous work that needs to be done around digging data up and connecting not just one or two data streams or 10 data streams before a decision gets made, which is what the human mind tends to do, but really look at hundreds and thousands of data streams, which is what computers and machine learning algorithms can actually do. But if we're able to leverage technology to give us better insights, to make us better at the things that we're actually good at doing, which is communicating, which is providing empathy, connecting with this human being that's in front of us, collaborating with our care team across the board, and doing what's in the best interest of that person that we're all trying to deal with at the other end, wouldn't that be great? So my challenge to the industry and perhaps to ourselves is, how do we get to that in the next 5 years, perhaps sooner? How do we make sure that we're able to really make technology invisible and make that dream a reality?
Well, that's a powerful vision for the future. Thank you for taking the time. I've enjoyed speaking with you today.
Thanks very much, David. It's been an absolute pleasure.
You have been listening to Harlow on Healthcare. Join us at healthcarenowradio.com. Let's continue the conversation on building the future of healthcare together at #HarlowOnHC. I'm David Harlow, keeping the fire going and holding a seat open for you. Until next time.